The most common reason why women have high testosterone is a condition called PCOS or polycystic ovarian syndrome. And there's a lot of women that have that unfortunately they have not been diagnosed properly. It's a clinical diagnosis, not necessarily a blood test. Of course, having high testosterone in the blood or high levels of DHEA sulfate can alert us as physicians that that's the diagnosis, but it's based on clinical symptoms. If you have a lady with facial hair that obviously is not normal, excessive facial hair, severe acne, the menstrual cycle's irregular, inability to lose weight. They just keep gaining weight despite, an adequate diet. Women that have problems with fertility. So those are all red flags, and you should be tested for PCOS. Once, if you do have that diagnosis, there are medications that will help you to try to contrast those symptoms. And, especially if you're pursuing fertility, if you're wanting to have kids, and the medications are very inexpensive. We can even talk about metformin, which is a diabetes medication, but it is prescribed for PCOS. Other medication like spironolactone will antagonize that testosterone level, and something as simple as oral contraceptives. It can regulate your hormonal level and will make, that woman feel much better, and they will think better about themselves because, all those symptoms will dissipate a little bit at a time.